We conducted a phase 1 clinical trial of locally manufactured CAR T cells targeting CD19 using the Miltenyi Prodigy system. And we measured circulating tumor DNA or ctDNA at baseline prior to lymphodepletion, after lymphodepletion at the time of our CAR T cell infusion, and on day 30 after infusion. Of the 31 patients enrolled, we had samples for 27 patients, and some of them were paired. What we found is that in patients who had measurable ctDNA at baseline, about 17 out of 20 patients had a decrease of their circulating tumor DNA with lymphodepletive chemotherapy. We used a slightly more intense lymphodepletion with 17. We use a slightly more intense lymphodepletion regimen where we use fludarabine at 25 milligrams per meter squared, but a higher dose of cyclophosphamide at 60 milligrams per kilogram. But this intense lymphodepletive regimen allowed for a significant number of patients having a decrease in the circulating tumor DNA. 17 out of 20 patients had a decrease of more than 1 log. That decrease in circulating tumor DNA was important because patients who had less than 250 human genome equivalents per ml had significantly better outcomes prior to CAR T infusion, but after lymphodepletion. So a decrease in ctDNA prior to CAR T as an effect of lymphodepletion resulted in improved outcomes. What is also important was that it affected overall survival, and we saw the difference in overall survival among those patients. In addition to this, we compared the changes in circulating tumor DNA after 30 days post-infusion of CAR Ts, and 21 out of 26 patients, and we have more matched samples, 21 out of 26 patients had a decrease in their circulating tumor DNA, and we observed that those who had undetectable circulating tumor DNA had significantly better outcomes, including progression-free survival benefit that was statistically significant, as well as an overall survival benefit that was statistically significant. I think these results are important and confirm what is observed in other trials where circulating tumor DNA is used as a marker of the depth of response after CAR T cells, and in general can show that the CAR T cells are rapidly active in controlling the disease. We continue to monitor the circulating tumor DNA of these patients to demonstrate whether a relapse can be heralded with a circulating tumor DNA recurrence.